Have you ever experienced that sudden, urgent need to use the bathroom only to find it incredibly painful when you do? You might even feel a burning sensation. If this sounds familiar, you might have had a urinary tract infection, or UTI for short. UTIs are incredibly common, especially among women. Don't worry though, they're usually not serious and can be easily treated. But even though they're common, it's important to understand what UTIs are and how to deal with them. That's what we're going to talk about today. We'll discuss everything from the causes and symptoms to the treatments and prevention tips. So let's dive in and empower ourselves with knowledge about UTIs. Simply put, a UTI is an infection that occurs somewhere in your urinary tract. Think of your urinary tract as the system your body uses to get rid of waste fluids. This system includes your kidneys, which filter your blood and produce urine. Then there are the ureters, those tubes that carry urine from your kidneys down to your bladder. Your bladder stores the urine until you're ready to release it. Finally, there's the urethra, the tube that carries urine from your bladder out of your body. Now, any part of this intricate system can get infected, but UTIs are most common in the bladder and urethra. These infections happen when bacteria, often from the skin or rectum, find their way into your urinary tract. Once inside, they multiply and cause an infection. While UTIs can affect anyone, they're significantly more common in women. This is largely due to anatomy. Women have a shorter urethra than men, making it easier for bacteria to travel up into the bladder. That's not the only reason though. Hormonal changes, certain contraceptives, and even something as simple as wiping from back to front after using the bathroom can increase a woman's risk. Men aren't completely immune to UTIs though. As men age, their risk of developing a UTI can increase due to factors like an enlarged prostate or other health conditions. But regardless of your gender, understanding the causes, symptoms, and treatments for UTIs is crucial for maintaining good urinary health. Picture this. Our bodies are like bustling cities, teeming with all sorts of microscopic residents. Most of these tiny tenants are harmless, even helpful. But every now and then, some troublemakers move in bacteria. When it comes to UTIs, the most common culprit is a type of bacteria called Escherichia coli, or E. coli for short. Normally, E. coli lives peacefully in our intestines, helping with digestion. But if these bacteria sneak into the urinary tract, they can quickly turn from helpful residents into unwelcome invaders. The most common route of entry? From the rectum to the urethra, especially in women due to their anatomy. Remember, wiping from front to back after using the bathroom can help prevent this. Section 2. Women and UTIs. A closer look. We've mentioned that women are more prone to UTIs than men, and it's not just about the shorter urethra. Hormonal fluctuations, especially due to estrogen levels, can play a role. Estrogen helps maintain the health of the lining of the urethra and bladder, making it harder for bacteria to latch on. However, during menopause, estrogen levels drop, increasing the risk of UTIs. Certain types of birth control can also increase the risk. For instance, diaphragms and spermicides can sometimes disrupt the balance of bacteria in the vagina, making it easier for harmful bacteria to thrive. Pregnancy also brings about hormonal and physical changes that can make women more susceptible to UTIs. Section 3. Risk factors beyond gender. While women are more prone to UTIs, men aren't off the hook completely. As men age, their prostate gland can enlarge, sometimes pressing on the urethra and making it difficult to completely empty the bladder. This can create a breeding ground for bacteria. Other factors that can increase the risk of UTIs in both men and women include having a suppressed immune system, diabetes, kidney stones, and any condition that obstructs the flow of urine. Additionally, frequent use of catheters, which are tubes inserted into the urethra to drain urine, can also increase the risk of infection. Section 4. When to be extra careful. Being aware of the common causes and risk factors of UTIs is an important step in prevention. But sometimes, even with the best precautions, UTIs can still happen. That's why it's crucial to be able to recognize the symptoms early on so you can seek timely treatment. Remember, early detection and treatment are key to preventing complications and ensuring a speedy recovery. Table of Contents, Part 3, Symptoms and Diagnosis, about 5 sections. Imagine this. You're going about your day when suddenly you feel a frequent, almost desperate urge to urinate, even if you just went a little while ago. But here's the catch. When you try to go, very little comes out, and it might even sting or burn. These are classic signs of a UTI, especially if they're accompanied by a persistent feeling of pressure or discomfort in your lower abdomen, just above your pubic bone. And it doesn't end there. The urine itself might look different too. Instead of its usual clear, pale yellow color, it might appear cloudy, darker, almost like strong tea, or even slightly reddish if there's blood present. Don't be alarmed by the color change. It's the body's way of signaling something's off. In some cases, you might even detect a strong, unpleasant odor from your urine, adding to the discomfort. While most UTIs stay confined to the bladder and urethra, sometimes they can travel upwards, affecting the kidneys. This is a more serious condition called pyelonephritis, and it requires prompt medical attention. So how can you tell if a UTI has spread to your kidneys? Keep an eye out for more intense symptoms like a high fever, chills that make you shiver, and pain in your back or side, right below your ribs, where your kidneys are located. Nausea and vomiting might also occur, making you feel generally unwell. If you experience any of these symptoms along with the typical UTI signs, don't hesitate to seek medical help immediately. Remember, early treatment is crucial to prevent potential complications and ensure a swift recovery. UTIs don't discriminate based on age. They can affect children too. However, recognizing the signs in younger children, especially those who haven't yet mastered potty training, can be a bit trickier. They might not be able to articulate what they're feeling, so it's important to be extra vigilant. Look out for any unusual changes in their urination patterns, such as increased frequency, accidents despite being potty trained, or complaining of pain or burning while peeing. Other telltale signs include fever without a clear cause, irritability, unusual fussiness, loss of appetite, or even vomiting. If your child exhibits any of these symptoms, especially if they have a history of UTIs, it's essential to consult your pediatrician promptly. Early diagnosis and treatment are vital for preventing potential complications in children. Section 4. Getting the right diagnosis tests your doctor may recommend. If you suspect you have a UTI, don't self-diagnose. Your doctor is your best ally in determining the cause of your discomfort and recommending the appropriate treatment. During your appointment, your doctor will likely ask you about your symptoms, medical history, and any medications you're taking. To confirm the diagnosis, they will usually request a urine sample. This sample will be analyzed in a laboratory for the presence of white blood cells, red blood cells, and bacteria, which are all indicators of infection. In some cases, your doctor might recommend additional tests, such as a urine culture, to identify the specific type of bacteria causing the infection and determine the most effective antibiotic treatment. Section 5. Don't delay. The importance of seeking medical attention. Remember, UTIs are highly treatable with antibiotics. However, ignoring the symptoms or delaying treatment can lead to complications, especially in individuals with underlying health conditions or weakened immune systems. In some cases, untreated UTIs can progress to kidney infections, which can be more serious and require more aggressive treatment. It's always better to err on the side of caution and consult your doctor if you suspect a UTI. They can provide an accurate diagnosis, recommend the appropriate treatment, and offer personalized advice on how to prevent future infections. Section 1. Antibiotics, your first line of defense. When it comes to battling UTIs, antibiotics are the heavy hitters in your medical arsenal. Think of them as the superheroes swooping in to fight off those pesky bacterial invaders causing all the trouble in your urinary tract. These medications work by either killing the bacteria directly or stopping them from multiplying and spreading, giving your body a chance to clear the infection. The good news is, most uncomplicated UTIs respond quickly to a short course of antibiotics, usually lasting just a few days. However, it's crucial to follow your doctor's instructions carefully and complete the full course of antibiotics as prescribed, even if you start feeling better before finishing all the pills. Stopping the medication prematurely can allow some bacteria to survive, potentially leading to a relapse or even antibiotic resistance. Section 2. Decoding your prescription. Types of antibiotics for UTIs. Walking into a pharmacy with a prescription for antibiotics can feel a bit like navigating a foreign language. But don't worry, we'll break down some common antibiotics used for UTIs. One commonly prescribed option is trimethoprim or sulfamethoxazole, often combined into a single pill. Another frequent contender is nitrofurantoin, which comes in various forms, including tablets and a liquid suspension. Your doctor will choose the most appropriate antibiotic based on several factors, including the suspected type of bacteria causing your infection, your medical history, any allergies you have, and whether you're pregnant or breastfeeding. Remember, every medication, even over-the-counter ones, can have potential side effects. Your doctor will discuss these with you and answer any questions you might have. Section 3. Beyond antibiotics, soothing the symptoms. While antibiotics diligently work behind the scenes to eradicate the infection, you don't have to suffer through the uncomfortable symptoms in the meantime. Over-the-counter pain relievers like ibuprofen or acetaminophen can help tame the inflammation and discomfort, making you feel more comfortable while the antibiotics do their job. Another simple yet effective remedy is applying a heating pad or warm compress to your lower abdomen. The gentle heat can help relax the muscles in your bladder and urethra, easing pain and pressure. Staying well hydrated is crucial too. Drinking plenty of water helps flush out bacteria from your urinary tract and dilutes your urine, reducing the burning sensation during urination. Section 4. Home remedies. Can they really help? While antibiotics remain the cornerstone of UTI treatment, certain home remedies can complement conventional medicine and provide additional relief from symptoms. Cranberry juice, for instance, has long been touted as a natural remedy for UTIs. While it can't cure an existing infection, its active compounds may help prevent bacteria from adhering to the walls of your urinary tract. Another popular home remedy is D-mannose, a type of sugar that's thought to work similarly to cranberry juice. However, it's important to note that scientific evidence supporting the effectiveness of these remedies is still limited. Always consult your doctor before trying any home remedies, especially if you're pregnant, breastfeeding, or have any underlying medical conditions. Section 5. Recurrent UTIs, breaking the cycle. For some people, UTIs can become a recurring nuisance, happening several times a year or even more frequently. If you find yourself battling these infections repeatedly, your doctor might recommend a more tailored approach to treatment and prevention. This might involve taking a low-dose antibiotic preventively, usually after sexual intercourse or for a short period, to prevent bacteria from taking hold. In other cases, your doctor might suggest alternative forms of contraception if diaphragms or spermicides seem to be contributing to your recurrent UTIs. They might also recommend lifestyle changes, such as urinating immediately after intercourse, practicing good hygiene, and staying well hydrated to minimize your risk of future infections. Remember, breaking the cycle of recurrent UTIs often requires a multifaceted approach tailored to your individual needs. Section 1. Lifestyle changes for a healthier bladder. Think of preventing UTIs like maintaining a clean and healthy home for your urinary system. Just like you wouldn't want unwanted guests overstaying their welcome, you can take steps to make your urinary tract less inviting to those pesky bacteria. One simple yet powerful habit is staying well hydrated. Imagine your urinary tract as a system of pipes. Drinking plenty of water throughout the day helps flush out those pipes, washing away bacteria before they have a chance to settle in and cause an infection. Aim for at least 6 to 8 glasses of water daily, and consider carrying a reusable water bottle with you as a reminder to stay hydrated on the go. Section 2. Bathroom habits that matter. We've all been there, rushing to the bathroom when nature calls. But when it comes to preventing UTIs, paying attention to your bathroom habits is crucial. First and foremost, listen to your body's signals and don't hold it in when you feel the urge to urinate. Delaying urination allows bacteria to linger in your bladder, increasing the risk of infection. Equally important is practicing good hygiene, especially after using the bathroom. For women, wiping from front to back after urination and bowel movements is essential to prevent bacteria from the anal area from spreading to the urethra. Men can benefit from gently washing the tip of the penis daily to remove any bacteria that might be lurking. You know the saying, "You are what you eat"? Well, it holds true for urinary health too. While no single food can magically prevent UTIs, certain dietary choices can create an environment in your urinary tract that's less hospitable to bacteria. Cranberries, for instance, often take center stage in UTI prevention discussions. While research on their effectiveness is still ongoing, some studies suggest that the active compounds in cranberries might help prevent bacteria from adhering to the walls of your urinary tract. So, enjoying a glass of unsweetened cranberry juice or snacking on dried cranberries might offer some protective benefits. However, always check with your doctor before making significant dietary changes, especially if you have any underlying health conditions. We've established that women are more prone to UTIs due to their anatomy and hormonal fluctuations. But don't worry, ladies, there are specific steps you can take to minimize your risk. If you're sexually active, urinating before and after intercourse can help flush out any bacteria that might have entered the urethra during intimacy. Additionally, consider discussing alternative forms of contraception with your doctor if you suspect that diaphragms or spermicides might be contributing to recurrent UTIs. Hormonal changes during menopause can also increase UTI risk. If you're experiencing menopausal symptoms, talk to your doctor about ways to manage them and maintain good urinary health. Remember, knowledge is power, and understanding the unique factors that can impact women's urinary health is key to effective prevention. We've covered a lot of ground today, haven't we? From the ins and outs of your urinary system to those pesky UTIs that can sometimes disrupt our lives. But here's the takeaway. Your urinary health is an essential part of your overall well-being. Just like we prioritize a healthy heart, strong bones, and a sharp mind, we shouldn't neglect the incredible system that works tirelessly to filter waste and keep our bodies in balance. Think of it this way. Our bodies are like finely tuned instruments, and every part plays a crucial role in the grand symphony of life. When one part is out of tune, it can affect the harmony of the whole. So, let's make a pact to listen to our bodies, recognize the signals they send us, and take proactive steps to keep our urinary systems in tip-top shape. Remember that feeling of empowerment you get when you understand something thoroughly. That's the feeling we want you to have about your urinary health. Knowledge is power, and when you understand how your body works, what can go wrong, and how to prevent or address those issues, you become the CEO of your own well-being. Don't be afraid to ask questions, talk to your healthcare provider, and advocate for your own health. Early detection and treatment are key when it comes to UTIs, and understanding the symptoms and risk factors puts you in the driver's seat. So let's continue this journey of knowledge and empowerment together, taking charge of our urinary health and embracing a life filled with confidence, comfort, and well-being.